everyone, and welcome to our inaugural Zooming across the Pacific. This is our time to mark the International HIV Long Term Survivors Awareness Day. So we're very grateful and honoured to be able to do this. Just before we begin formally, we'd like to acknowledge and extend our appreciation to the traditional owners of the lands upon we're all meeting today, wherever we are, and we pay our respects to their leaders and elders past, present and emerging, for they hold the memories, traditions, culture and hopes of all the people of these lands. And so to all of you watching right now, if you know if you know the name of your Indigenous or Aboriginal land, feel free to put it in the chat, and that way we can see the richness and diversity of our locations of where we are, and a bit of the Indigenous and Aboriginal history. So wherever you are, yeah, feel free to put it in the chat right now if you like.
Hello. Could you maybe sit in the bedroom if you're going to have sound on?
Sorry, Jeff?
Oh, sorry. Oh, sorry. I was talking to my partner to move his sound away.
All right, all right. Okay, let's continue. My name is Vic Perry, if anyone doesn't know that. I'm a health promotion officer with Living Positive Victoria, and we're a community-based organisation that support people with HIV here in Melbourne, Australia. We're a statewide, state-based organisation. I coordinate our project Taking Charge, which support people with HIV 50 and over, and we do that in partnership with Thorne Harbour Health, which is another HIV org, with Jerry O'Brien, and we run the project together, and we have a couple of activities that we do as well. That's me, Jerry.
Yeah, so my name is Jerry O'Brien. I work at the Positive Living Centre, which is part of Thorne Harbour Health, and it's a community centre. It's a drop-in centre for anyone living with HIV. And as Vic has already said, I do some work with him too, and they, it's been traditionally over 50s and ageing, and we do a chronic disease self-management workshop. You may know about the Positive Self-Management, which is a Stanford-based workshop. Actually, it started at Stanford, so we do that too. Yeah, so looking forward to the session today.
And Jesus.
We were joking about that he will say, Jesus in the house! But, hello everyone. I am
forgot to say that.
I am super excited to be here because it means a lot to me. My name is Jesus Guillen. I am myself a 37 years HIV long-term survivor, Latino, immigrant, gay, etc. But more than anything for me, also representing, of course, this time, this amazing family, and I really mean it, of the HIV long-term survivors international network, that we have close to 5,000 people, even if we don't have many right now right here, but we will share the recording with as many as we can. And we also have together with us one of our amazing administrators, Xiomara Lopez, that I adore, and she's really, she has been amazing in her support to everyone. So Australia, hugs and kisses. I'm very affectionate.
Thank you. All right, so what we'll do, there's a couple of people that we're going to speak that are not here just yet, but that's okay. We'll move on. I guess one of the things that we can do is talk about and share a bit of a personal perspective, as well as talk about the community response here. I mean, this is about the early days of the epidemic, and in the 80s, 90s, and we can talk about what we actually did back then to address this incredible situation that came along. And we've got Jeff Harrison who can talk about that, and particularly as he was working in the HIV sector in community education, so he can give us a little bit of a rundown of what we did. And we also have, just very quickly, have David Menadue, who is quite well known and been around for a while, who knows quite well, I guess, with the larger or bigger perspective of how Australia did with the epidemic. So perhaps you can say a few words later to David, but we'll start off with Jeff.
All right, thank you. Look, and I'm really sorry I haven't got the my face up on the screen because it looks really good.
It's okay.
Yeah, it's kind of really interesting doing this, knowing that there's other people on there who also, like myself, long-term living with this virus. I remember it was back in 1988. I'd been working in touring Australian theatre shows overseas, and I'd just been doing Edinburgh and London and New York, and got back to Australia and ended up in Fairfield Hospital, which was the HIV hospital in Melbourne at the time. And that was like a near-death experience then, because it had got into my brain and stopped my brain working. They gave me about 24 hours to death without doing something, and they gave me then a month unless they could find something to stop it taking place. And that, luckily, they found a way to stop it, put a drug in me to stop it still working on my brain. But it took me weeks for the brain to start working again, to learn to speak and learn to think and all that sort of stuff. It was a really slow learning process again. I remember started to write, and my writing was just terrible, and spelling, I couldn't spell, all that stuff, because the brain had been turned off. So it was an interesting time to live through that. And it was soon after that I joined into there was a Victorian positive people's casual, like a lunch in a pub, in a community space down in the south of the city, which I went along to down there, which was set up by the Positive People Victoria back in the very early days.
Sorry? It was in Paran.
Oh, was it? Thank you. And it was great for me to meet other people who had HIV in Melbourne. And to help me to be a part of all that group of people. And it was from there, and people like David I met early on in the whole process.
Well, sorry, Jeff, what year was this?
That was it was 88, about 89, I think.
Yeah.
I probably went in 80. Yeah, 89, middle of 89, probably joined that group that David just mentioned. And it was about the same time as that I joined ACT UP in Melbourne, and was very active in the stuff that ACT UP was doing in Victoria, and then in the National D-Day campaign, which we operated out of at Parliament House in Canberra on the access death drugs, to get better access to treatments, and the Bohm report that came out way back then, which changed all the access to medications in Australia, which was being held up in the past, and I think we saw benefits from achieving what we achieved in that Bohm report. But there was, and I guess it was just about what year was it? About 92, I ended up becoming the president of the National Association of People with HIV in Australia, and did that for about 3 years. And on that position, I ended up doing a number of conferences, like the Berlin AIDS conference back in 93. Didn't present there. That was my first introduction to a conference, and went off and at least learned from other people and other organisations what was going on, and come across a number of wonderful people, which some of us know, like the head of Global Network People with HIV and Positive Women, and all those other people who I learned and met over there. And could learn from them what they were doing in their own regions, and help get some of that stuff happening back in Australia. And along with people like David and Bev Greet and those other people who we're all together, especially in Melbourne, and could start achieving all sorts of things, continuation of achieving things for positive people and what we were looking for. I don't know, there was, and I think then after about 3 or 4 or 5 years of volunteering in the HIV sector in Australia and overseas, I ended up moving into work in the Victorian AIDS Council. I was volunteering in what was it called? HIV education, which was the first introduction of education for people with HIV within an AIDS council. And that was that would have been about 91, 92 when that was started. So it was a very early move to get an AIDS council, an AIDS organisation starting to move into doing active work for people with HIV. And we set up some excellent outcomes and materials and campaigns to help bring about changes of people's within the gay community and gay and lesbian and our little group of our own small communities, but also out in the broader community about the concept of living with HIV. And some of that was done. We set up a radio show. I think it was a weekly broadcast on 3CR radio, which was the HIV, what was it called? The HIV, Treat Me Right. That was the, Positively Primed, a radio broadcast in 1992. And that went on for about a year or two. That myself and Bill Hathaway, who was the HIV education officer at the time, he and I set that up and did a radio broadcast. And we also set up a print column in 92. Treat Me Right, it was called, in one of the local monthly papers. So we were writing the column in there, and that was all about people with HIV and what our issues were and what we were looking for and trying to achieve. At that stage, a lot of that was on treatments, because there was nothing much in treatments. There was like AZT, and DDI and DDC were about the early treatments around in that period. And we also learned, I learned myself, starting on high dose AZT in 1991, and after 2 years, dropped that down to a lower dose AZT, and then added a DDC, which I was getting from the Buyers Club in New York, and added that onto my range of medications to take. But after a few years of that, you could see those things weren't working. That was just, I was losing weight and losing abilities and the whole thing, until further medications came along a bit later on, which was, thank good now, like on about 34 years of taking pills, and I'm still a moderately healthy man for being, nearly 68 years old. It's just, I know that half of my life now has been taking medications. And I suppose, can be a skeptic about some medications because we know what some of them have been like, but at least it's helped sustain my life. And especially when I look at, God, so many friends and colleagues who've passed away over the years from HIV. We have the list of people. It would be incredible to think of how many people we've lost.
Going back to the early days of the Victorian AIDS Council, you mentioned. So a little bit about that. So they were doing quite a bit of prevention work before they got into education for people with HIV.
Yes, they were. And I think through Bill Hathaway, when he was the first HIV, he was the education officer, the employed one, and I moved in as the convener of that group. So I was working in the office, the education office, which was a separate building to the AIDS Council. So I was working with all the guys in there, working on those projects. And we brought in a number of things. One, start bringing about preventing the transmission of the disease, of course, but also bringing in the people with HIV need to stuff their own health and well-being, which was more than just transmitting of a virus. It's how to look after your own health, what you can do, whether it's in your diets and your exercising or your support groups and all that sort of stuff, which we helped set up in the early 90s. Some of the other things we did then was like, there was a conference we also did. It was sort of mapping our enemy, which was kind of an ACT UP and PLWHA treatments workshop conference we did in Melbourne, which was a really good one. And it brought people together to be able to talk about how to map your enemy, the enemy being a fucking disease we had, you know. So it was to help get past that stuff. Some of the other stuff, what else did we set up? The HIV positive project. So was a couple, there was one was a media campaign to put positive people up front, that people could be comfortable starting to come out about their statuses to other people, and some to be more publicly open about their status. To do that sort of stuff helped break down some of the barriers that had been around in the past. A lot of the media in the past had been so anti-HIV or fear tactics of HIV, because they could see it in that stage as just being a gay man's thing. Whereas we knew that was incorrect. But you know, to train some of the media to change their own attitudes took a long time to some of that happen. Some of that still comes up today. You can still see some of that in things that go on in the media. But I'm trying to think,
Jeff, about those early days of the, I guess, the fear and the stigma that was around from HIV negative gay men towards positive people. You know, what was it like? Was it really bad that positive people were sort of made to feel like lepers?
Yeah, I suppose, yes, some people were. I mean, I suppose at my stage I was in a serious discordant relationship at that stage, and that wasn't a problem at my relationship at that period of time. Whereas others I know, some people were rejected. Now, positive people rejected by families, rejected by friends, rejected by other sections of the gay community.
I was one of the first people to. The HIV test didn't come in until 1985 here. I think overseas it might have been a bit earlier, but 84 was when I got diagnosed, because they had a thing called gay-related immune deficiency, they were calling it then, as if it was all going to be gay-related. As Jeffrey said, over the years it's been less and less so, but I didn't quite know what it meant. And my doctor at the time, David Bradford, said, "Oh, we think maybe 1 in 10 chance you'll get sick." Well, as the years went on, we knew that wasn't going to be the case. And Jeffrey's talking about our political action, and really late 80s. I was in a peer support group called Melbourne Positive Friends. And it became clear that we were going to have to be a bit more visible and make sure that, because at the time everybody with HIV was being looked after, as opposed, you didn't see people with HIV. And what Jeffrey's talking about, the visibility stuff, became important. We had to have people in the community see people with HIV and see they're just normal human beings, deserve compassion and understanding, and to work with them. And so I and Jeffrey and a group of us set up initially it wasn't called Melbourne, it wasn't called People with AIDS, but that's what it became. In the late 80s, we sort of had the beginnings of one. In fact, believe it or not, the first thing that happened in Australia was that the National Association was set up first. We did it at a conference in Fairfield, I think, in 1990. And we just said we want a national association. Every state can be involved and all this stuff. But of course, there was no funds. You know, it took a while before people living with AIDS themselves became something that government accepted as an entity. It was always in those times the AIDS councils that were looking after everything. And the only way we managed to get our organisation started was as a part of the Victorian AIDS Council, who sort of gave us the office space and put us on the board and all that sort of stuff. But it took a while for us to actually get our own resources. And it wasn't really until probably 92 or 3 that the National Association got a little bit of money. Again, that was through a FAO, not through a separate grant. So, you know, it was quite difficult to actually get the positive voice out there.
But what happened in USA besides HIV, it was the government reaction immediately to what happened with HIV. In the early 80s, it was not only legal for anyone to immigrate to USA if you were HIV positive, that was the case in myself, but also literally in newspapers, it was written that HIV was happening to the worst of humanity. And I still remember very much when I was reading this, because it says the gays, the homosexuals, the drug addicts, they were mentioning these people that for the media, literally, that's what we were listening to. So definitely, we know, and I'm sure Zio is going to put also a lot about this, the government was not helpful at all. But also the stigma and the discrimination that was happening about not using the same bathrooms, the idea that a mosquito might come and get it and pass it to you. So many families literally throwing their sons and and some daughters as well, and it happens also to straight people, and that's what also is here. Even if a lot of the gay community was represented, is that they were thrown out into the streets, and not only we can see in the newspapers how every day in the newspapers place where they were putting the people dying, it was pages of people dying every day. And for me, like, one of the saddest moments, and I put the link on the chat of this documentary, that even again, every story is so powerful, is just simply seeing the pages on a hospital, how many people were dying. Many people lost complete families in matter of weeks or months. All of their friends completely were gone. I arrived to USA in 1984. In 1985, for a crazy reason, I just became part of this study, and I knew exactly who gave me the virus, who passed it to me, and that person died in 1986. I moved to San Francisco in 1990 from Los Angeles. That's what I was before. And I remember that feeling of all the people always almost like just, and I have heard it from so many people, just ready to see if John is still here, is Paul is still here, is this person is still here, because there were so many people that they were dying day by day. And I want to mention also that one of the memories that really was very strong for me, because we already were talking about ACT. I remember about very early 90s, 92 or something like that, going to the gym. And that was also the time when many of the people were also experiencing KS. I was one of those people that also experienced KS, and having, again, all these things. But at the gym, you will go in one of the physical ways that you will see in people, besides facial wasting, the hump, KS, all the different spots everywhere and everything. When you will go to the gym, it was almost immediately noticeable, because you will look at the back of the guy and he was almost completely no muscle at all. And they were aware of these things. I was aware of my KS. I was like many of these people, but also just in the moment that people knew that you were gay, it was that assumption immediately that you were HIV positive. And in the other side, if you were HIV positive, the assumption that immediately you were gay. And I just want to, on this rambling, saying it's so difficult, and I feel almost like Miss America right now, trying to represent all the stories that I hear every day still from so many people is incredibly difficult. And I have to mention before anything else, our transgender community, our straight brothers and sisters, the mental health issues that so many people are passing by. And with that, just that stigma and discrimination, guys, you really, when I'm listening to your conversations, at least for what I see in the USA and what I hear in many other countries, the stigma hasn't disappeared. I'm gonna end this little portion to pass it to CEO with this. Just yesterday, I read this article that CECIDA from Spain, they did an experiment. They put an ad for an apartment in Barcelona, or I forgot exactly where. And the apartment was fabulous with so many, things happen, super great price. And at the end, the guy was saying, but I have to be honest, and I happen to be HIV positive. So immediately the response was, lots of people. And at the end, 80% of the people or more never called back. Even if he had so many good things that this apartment was still. And remember, guys, also that in any dating website, still the only question that they ask, the only question about health issues is, will you date an HIV positive person? Check out the site's websites. They don't check, will you date a person with cancer or with asthma or with bad breath or whatever. It still is the only question, will you date an HIV positive person? I'm here representing immigrant Latinos and many things, but I want to pass the voice to Zio, because Zio, I think she will have a lot of things to add, because still in these days, many women are not represented in many studies for HIV and for many other resources. So Zio.
Thank you, Jesus. I consider myself something of a unicorn when it comes to HIV. I was a healthcare worker. I was exposed at work. I was drawing blood from an AIDS patient, and she jerked her arm, and the needle went from her arm to my hand. And 4 months later, I tested positive. And there's not a lot of people who have that history. And I've come across health workers who say, oh, no, that's not true. And I said, well, yeah, in 1993, it was true, because there was no post-exposure prophylaxis. They didn't know about that until about 3 or 4 years later, that if you took a cocktail for a month after you were exposed, you could stop yourself from becoming positive. I was before that time. Like everybody else at that time, I was told I had 5 to 10 years. I had an 18-month-old son. I was married. I'm straight. And they told me, make good memories with your son, because you're not going to get to see him grow up. He might as well have some good memories with you. I had a doctor who was amazing and said, look, right now, most people don't start medication until they have AIDS or are at least under 300. But you just exposed. It's your choice. Do you want to start medication now and save your immune system, or wait until you start getting sicker and then start your medication? I started medication right away because I wanted to be alive. I wanted to see my son graduate high school. Well, my son graduated high school, college, and it's going to be 30 in a week. I'm happy to say. And also, I got pregnant with HIV. And in 2000, I had a daughter who is HIV negative. And that was thanks to the doctor, who was incredibly supportive and incredibly ahead of the game when he says, you want this baby? This baby's going to be healthy. Let's do this. So even though I was having a successful struggle of my own with HIV, I literally lived in the HIV closet for 22 years. I did not tell many people. My husband knew, obviously, and our 2 closest friends, and that was it. Being Cuban-born, Hispanics have a really big stigma against people with HIV. until this day, most people I tell about my HIV, yes, I'm HIV positive, they immediately turn around and like, check your medical box. Well, how did you get it? Drugs, alcohol, being promiscuous. I'm like, no, I was a healthcare worker and I got stuck with a needle. And they're like, oh, I don't know what box to put that in. And I'm like, yeah, well, I'm here. We'll deal with it. But it took to 2016 for me to finally come out and tell my story publicly. And I hadn't gone to any support groups. I'm hearing all you guys how many years you've had found a way to meet each other. I hadn't met a person with HIV other than a patient in the hospital that would help. I had not support until I found out about HIV groups on Facebook. And one of the first ones I reached out to was Jesus Group. And that's how I ended up being an administrator after a couple of years. I didn't know that these groups existed, and hearing all the people's messages told me, hey, we all got here in a different way, but our stories and our fights and our struggles and our horrible reactions to those early meds from the 1993-94 times with AZT, I started with that too. We all share it in common, and it's something that binds us together in a way that nothing else can, regardless of everything else that is different in our lives. In 2016, my partner died. He was living with HIV. Not my husband. My husband and I got divorced. Actually, being afraid to give him HIV killed our marriage. I killed our marriage because of my fear. And after he and I divorced, we actually became friends again. So we raised our 2 kids as friends. But I did not find out about sharing and how strong an impact it can make in somebody's life to share your story and your struggle. You might reach them in a point where they feel hopeless. And one word you say, one sentence you say might connect them and get them through the next day and the next day. After my boyfriend passed, I said, I'm going to continue working in the HIV community and reaching out and seeing if I can make a difference. I started volunteering in New Jersey with an AIDS service organization called Buddies of New Jersey, which serves communities in North Jersey where I live. I've been there since 2016. And 2 years ago, I actually joined the board of directors of that organization as the first person living with HIV to be on their board. And I kind of thought that was embarrassing for the board, because how do you manage an organization and yet don't have a voice on the board of somebody living that journey? And I'm very happy to say that even through COVID, we provided services. We provided food, we provided case management via Zoom, via telephone, via anything, food, clothing to people, still had transportation to medical. And hearing all you talk about the drop-in centers, we are just now expanding our facilities to have a drop-in center, not only for people living with HIV, but for the younger crowds now who we're trying to reach about prevention and PrEP and offer testing and education that they're not getting in the schools here in New Jersey. So we're trying to come at this from different ways. People who are living with HIV and those who are at high risk for it too. It's been a strange journey, because as a straight woman, as a married woman, when I got the disease, I can't tell you as a lab tech how many people I tested who were in committed relationships, and apparently the partner cheated. And the only way we found out is because they got sick, and that's how we found out they had it, and their partners had an advanced stage of disease. So it's like, there's no judgment. We're all in this fight. We're all in this journey. We're here. Let's move forward. And that's always my message. It doesn't matter where you came from. You're stepping through this journey together.
At this point in time, I am the president of CLASS, Kuala Lumpur AIDS Support Services Society. We're a small organization, and we've always been under the radar, basically, because we are about 20 years old in the NGO field in Malaysia. But the thing is that when we started out it was basically peer support in the hospital. It was started out with just a HIV positive person talking to another HIV positive person in the clinic. And when the organization was formed, that was our core program that we ran. We called it the Hospital Peer Support Program, HPSP. And that worked very well until the government decided to take it on and replicate that in all the other countries, all the other hospitals across the nation. They changed the name to Treatment Adherence Peer Support, TASP, and that was good. So at least we know that something that we did, something that we started, actually was recognized by the government, and they took us as an example how well we managed our clients over the years. And then we have a shelter home. Basically, we had one for women and one for men, but we've lost the women one due to funding. Now we might lose the men one as well.
I'm in town visiting Jesus, and again, storytelling. Thank you much. I'm positive 26 years, but I came out in 1982, right after college, right after my parents paid for my education, and then I moved to Boston, and I didn't become positive in 1996. I duly diagnosed bipolar and HIV at the same time, and so I know. I sit on the fence on both issues, and I'm a member of the National Association of Mental Illness, and then I'm on this particular group. I'm a community advisory board at Calmar Community Health Center in the city, and so I've always involved fundraising and just anything, safe sex kits, you name it. We're out doing it, bowling leagues, raising money from it. Yeah, so that side I was on until I diagnosed, and then. Once I got involved with SAMHSA, the Substance Abuse Service Administration in New York, they awarded me a fellowship. So they, awarded me to go out and talk to people, use my voice, share your story. And it was so nice when I do that everyone that can identify with a mental health issue would actually say, it's so good to know that someone else with HIV is dealing with mental health. And that's the connection I make with whoever identifies with that particular thing. And how I met the group, Jesus's group was not many groups wanted to hear my story. I don't want to hear that. It's like a reverse stigma. It's a stigma against mental health. I don't want to hear it. And so the long-term survivors group, they accepted me. I put who I was, and I'm happy to say I met a few people in there, and we talked about mental health. And so that's all I wanted to share. And I just, mental health is, I can't say for every part of the country. I could tell you in the United States, we now have 6 states that have HIV and aging laws on their books. It's basically about cultural competency. Getting it where you can go to the doctors and nurses and they have to treat you, nursing homes. So that there's, New Jersey is one of them, California, Illinois, I rattle them off, but there's, that is slowly happening. Mental health services in New York, as far as where I go, New York City, and actually Brooklyn has the only long-time outpatient mental health facility. It's called Rainbow Heights Club. And within it's self-run. So there's a group called Bitch and Stitch, and there's a group called that specifically just with HIV. So and I'm on that particular group. So there are things happening, and it's like it is pockets here and pockets there, but it's happening. It is happening.
A huge thank you to our speakers this morning, and acknowledge particularly for people from San Francisco. You mightn't know this, but I'm a keen student of our HIV history in Australia, and Australia was a couple of years behind in those rises of infection rates in the early 80s, and a decision was made at a bipartisan level of our government to send our Health Minister, Ian Blewett, across to both New York and San Francisco to view the various responses to HIV in that early stage. we decided to follow the San Francisco model because it had a foundation of community-led leadership. And I think it has been a really, really significant part of the communities that we've been able to develop here in Australia, and the strong community-led ethos around everything that we do. I feel so privileged. I was diagnosed at 19 when I was in 1989. I feel so privileged to be a HIV positive CEO of a HIV-led organisation with an entirely positive board. And I think the foundations of this were made in those early decisions and those immediate glimpses at the difference of the response within the USA. So I want to acknowledge San Francisco for their unknowing but significant role that they had in us developing our response here in Australia. And it's been wonderful to see everybody this morning, and I thank you.
The words HIV long-term survivor, especially scare, honestly, it hasn't been almost acknowledged. They talk a lot about HIV and aging or 50 plus, but it's almost like they are afraid to mention HIV long-term survivors. And the reason, Vic, is because you even mentioned we had to focus right now in before the 1996 period. What happened in the USA is that there has been a couple of movements, and I can understand it, but definitely, especially the mental health issues that happen are very particular and physical to before 1996. But now many agencies and organizations are accepting the 10-year period. That is a whole different historical portion of it. So we are looking, and this is also something that happened only about 5 or 6 years approximately, and that's when the group of that I'm just lucky to have pressed a few buttons right there was founded. We never really were talking before about HIV long-term survivors about 5-6 years ago. It was like many of the people, the response was, I felt that I was the only one. I felt that I was alone, and we started getting together. We are pushing, a few of us, to have palliative care, housing. Of course, you know, the San Francisco Bay Area is out there, incredibly expensive, and sadly, politics, every time that they say we're going to have low-income housing, they build 300, 400 units, and maybe 4 are for low-income housing. But a few of us, we are pushing a lot for all of the things that you mentioned. Pharmaceuticals, I work a lot with pharmaceuticals as well. I have a special angels in a few of them that they are very willing to work with us. And by the way, guys, right here in San Francisco, in an organization called Open House, I don't know if there's anything in Australia like that, but there is the first mural or physical acknowledgement for HIV long-term survivors. And because of COVID-19, it was stopped opening or acknowledging this. So hopefully in a few months, there's going to be a big event about that. Sadly, I have to say that the worst HIV long-term survivors, sometimes they are not acknowledged as much.
And it just reminds me of, I guess, an ongoing debate we've had in Australia for many, many years about how we break down funding and provide services. And it's the same in sexuality too with gay and lesbian health. It's about not necessarily giving more money to specific HIV service or a specific gay and lesbian service, but how do we make the mainstream services which get a bulk of money more HIV friendly or more gay and lesbian friendly?
Yeah.
So people with HIV should feel safe and feel free to be able to use any other mainstream service.
Yeah, super important point about what John was asking also. I don't know the ages of all of you guys. I am a 62-year-old man at this point. And one of the things that we've been trying to do is the intertwining of aging services with the HIV services. At this point, many of the HIV positive people still are almost afraid to what's going to happen when they get to be 65, officially an older person. We haven't been able to really intertwine these services really well. Sadly, part of the problem, and there has been some studies lately that I was part of, the gay community does not approach senior services in comparison of another person, maybe about 40 or 50% less than the average person. So we have a huge problem because our communities are getting older, and then we have the HIV long-term survivors, and we still don't know where are we going to be going. So that's a huge, huge problem. So we need to, like you're saying, they might not give us more money, but we need to work with what we have. So,
because one of the things we need to do as we're getting older and entering aged care, whether it's institutional aged care or home-based or community-based aged care, we want to make sure that the people that are looking after us are not going to have an issue with our HIV. So how do we build that capacity in the workers in that area in mainstream? So it's because we're not going to have HIV-specific aged care homes. And do we want to enter a home with only positive people?
All the points that you all touched here is very something that I'm looking at right now, because in terms of getting older, you might not see it, but I am actually 62 years old. So I'm in that category of senior citizen, and I get my discounts on public transport and all that crap. But the thing is that there are no shelter homes in Malaysia who are willing to accept a PLHIV. That's why we are struggling so hard to keep our shelter home open, because when I get to that age where I need someone to take care of me, that's one thing that I'm trying to set up. It's kind of a retirement home, shelter home, something that I can set up for the community, but it's more importantly for me and my friends here who are all getting a little bit older every year. But the thing is that we are trying to look for the big shots, the people with the money and the land, to get a piece of land, maybe build a place where we could plant crops or something like that. But that's long term for the shelter home. That's something that I would like to do for the organization. But overall, what a lot of you said here is very important, because I also have many clients who are also bipolar, and I'm currently dealing with one right now, and he's not even on treatment yet. So his journey to health recovery hasn't even started. Where many people that I know here, that I've met here today, are virally suppressed and have dealt with a lot of different issues. And I am still struggling to get him to deal with his psychiatric appointments and his HIV appointments and not miss them. And because when we speak, that there is so much that he believes he knows, which is correct, and nothing that I can suggest helps.
Hi everyone. Good morning and good afternoon, good evening. I just wanted to chip in because my experience is a little bit different, and I thought just to add that diversity. So I've been, positive for a very long time. I'm definitely a long-term survivor, as they say, but I'm quite a relatively newcomer to being active in the HIV space. So, I really pay my respects to all of those HIV champions who have, spent so many years advancing the rights and needs of people living with HIV. I just, just about me, I'm 48. I'm married to a woman. I have 2 teenage kids, and I acquired HIV as a kid around the age of 10. I don't know when I seroconverted or when I tested positive for the first time. I was a member of a risk group, being a person with a bleeding disorder, and I was frequently and routinely using blood products in those years to treat my bleeding episodes. And so, as you can imagine, travelling through adolescence, knowing that HIV had something to do with me, or had a lot to do with me, you can imagine how that profoundly shaped the person that I've become. And it was all very secret. Only my parents knew. Even my siblings didn't know, and we were a close family. Something like, skipping forward a few years, something really dramatically changed for me in my life around 2015 or 16, and I decided my story was something that might be able to help others, and I wanted to tell my story, I guess, and also I could see how other HIV champions had reduced stigma for me, and I admired that very much, and I wanted to do the same if I could. So here I am now, living openly as a heterosexual man with HIV in this country, and organising, hopefully, a national network of heterosexual men living with HIV, so that we can connect with each other and be a voice to policymakers, to other organisations, and to institutions. So that's it. Thank you. I just wanted to chip that in. Thanks, Vic.
Thank you so much, Anth. Actually, I guess I'm interested in, so what does it actually feel like, though, in terms of your situation, and I guess particularly with your sexuality, being surrounded by so many gay men, because, and in our situation, and I'll speak only for Melbourne, Australia, I know it's different in other jurisdictions, the proportions of genders, sexualities vary, but in Melbourne and Australia generally, it's been pretty much gay male, a large proportion of people with HIV. So what's it been like as a straight guy, with us gay fellas?
Well, to be totally honest, it just feels like a privilege, to be in the HIV space with so many gay men, and to, I guess, to learn from you all, but also, I guess, going way back, growing up as a young straight lad in Australia, there was a lot of homophobia, so I had to unlearn that, and having got there, I hope, it's a massive reward. So I feel like I'm in just a privileged position. It got great honour that not many people would have. So it's not a negative at all. It's all positive.
Can I tell you, and honestly, we need you. And not talking about the whole world. Even in our group and in the communities that I work in, so many different levels, we don't have many straight guys' voices that can speak honestly about things. Just a few weeks ago, I still get a phone call from this lady in Texas that even her kids and everyone else, does not know that she's HIV positive, and she's hiding to take her medications. And with guys, I many times I'm looking also for straight or bisexual, or now even sexually fluid, or so many other terminologies. But we need you for real, and if you can handle the flow and yeah, I'm sure there will be many guys that will cruise with you, but we need you as a voice for real. Okay.
Thank you, Jesus. Well, it took me a long time to be able to venture into the space publicly, and there's very few of us who can. in Australia that I'm aware of. So I feel like it's a really long game. It's just about supporting others to come up behind. And I guess I can think of a couple of other heterosexual men who provided me with a model about doing that, and I could see them do it pridefully. So I just hope that I can do the same for others, and maybe slowly build something over time. It's a long game.
Just up in a small regional area like Lismore, some of the services are hard to come up with. Like I because of the early drugs I was in, I have sculpture done on my face every couple of years just to rebuild the dropping face that turns up. The closest I can get it here is a 2-hour drive away. It's the only way you can get that service. So there's a number of things like that in regional areas which are much harder to get as opposed to living in the bigger cities where you've got all those services somewhere around you in the big places. So somehow in the systems we need to work out, especially now with COVID, reducing services within the medical system. Like even the HIV service we have here has not got flooded out, so you can't even see them. You can only talk on the phone with them at the moment. So it's problems like that which we're sitting around at the moment, which somehow have got to be worked out. Yeah, the other thing, like we have, like I've formed the Positive Guys support group here. Once again, set up a support group because the largest positive community outside of capital cities of Australia, and there was no support groups operating. You set them up and they run, and they've been going for about 3 years here in Lismore now. And it still meets once a month. A small varying group of people come in, but there's no support in the system to see that still keeps operating or expanding out to reach the other ones further out in the region. So there's things like that which are just in the hard basket at the moment, you know. So you keep working on it and getting other people involved, and it happens. But you know,
yeah, that's I guess that's always been an issue in terms of, I guess, location and matching location of services and where people live. And in Australia, you know, while we are very urbanised and many of us do live in major cities, we're spread out as well. So how do we do that? How do we ensure that there's equal access to services in the context of geography? Not that simple.
If I can, Vic, and yes, I said I wasn't going to talk. So now that Jess brought that up, I live in Geelong area, and that's only 45 minutes from Melbourne. And I used to live in Melbourne. I still have to go to my GP and to the Alfred Hospital, which is the primary HIV hospital in Melbourne. But there's nothing in Geelong, and it's only 45 minutes away. We only have like about 6 hours at the hospital, general sexual healthcare from the federal government. We just recently got 2 hours from the state government at a private provider, Cardinia Health. I can't get any health services that I need at age 65 as a long-term HIV survivor. And to use the California terms, Jesus and anybody else there in California, during fire, flood, earthquake, riot, and our industrial action and COVID, and simply not well enough to get in to the capital city, we have nothing out here, absolutely nothing, except for HIV prescribers. We don't have drop-in centers. We have no community. Just it's complete isolation and stigmatization.
Okay, we've hit 12 p.m. here in Melbourne. Sunny Melbourne, Australia? No, it's not. It's dreary and wet and cold.
It's sunny down on the Surf Coast, by the way. So you're gonna get the sun soon.
Blue sky, Lismore.
Great.
Can I say something really as fast as I can? First, thank you, Vic. Thank you guys for this connection. I am not an agency, you know, and that also goes to Ant and to anybody else that, especially in these days with social media, you know, it's amazing what you can do. Sometimes there are days that I feel like I'm not doing anything. And then are days that I can really see how much really this group that started, you know, of 100 people and now close to 5,000. And I have to acknowledge again, all these people that tell their stories and support each other. And that's what this group, and I have no money behind, and this group help each other, support each other in the best possible way that they can. And sometimes we can do a lot even without any money. So thank you, Australia.
Well, thank you, Jesus, and thank you all. Thank you so much. It's been really good. I think we've really learned some insights into a whole variety of situations.
Thanks so much. It's been a fascinating conversation, really has, and really interesting to see, you know, both from Malaysia and America. And yeah, look forward to just keeping some sort of contact, really.
All right. Well, thank you again, all, and have a great rest of the weekend and week, whatever day, time you're in. Thank you.
Thank you very much, everyone.
Bye.
Bye.
Bye.